Hi, everybody. Welcome to my show. I'm Dr. Angie Rasmussen, coming to you today to talk about several very important and, as usual, completely depressing issues affecting us in health and science. I'm going to start off with maybe some good news, but I actually don't necessarily think that it is. And that has to do with the Ebola outbreak. So yesterday we talked briefly about how the numbers have gone down. And I want you to put a pin in this because it's really important. The reason that the numbers have gone down is because there was a huge lag in diagnostic testing availability. Doing diagnostic testing and identifying cases in an outbreak early on like this is really, really important because Ebola can look like a lot of other things in this part of the world. Bundabugia virus, we actually don't know that much about in terms of the symptoms that it produces in people because it's only caused 2 outbreaks before this one. But some early reports that I've heard from some of my friends on the ground who are clinicians who actually are talking to the doctors locally and who are themselves, in some cases, treating Ebola patients, are reporting that the symptoms are largely not hemorrhagic, which is not that surprising because we've seen this before. In larger outbreaks of Ebola, it appears that the hemorrhagic syndrome that people think of as like Ebola virus disease doesn't really happen. And usually that is not as pronounced. It's not like the movie Outbreak where there's blood all over the place. Usually it's actually a rash, a petechial rash that happens when your capillaries start leaking and it causes this sort of little mini blood blisters all over the place. That's not really happening, at least from these early reports. It seems like most of the disease is gastrointestinal, a lot of non-hemorrhagic diarrhea without a lot of signs of hemorrhage. So that means that, this could look like a lot of other different things that are endemic to the area in the Democratic Republic of Congo and Uganda, including malaria, including gastrointestinal diseases, including sepsis, including other hemorrhagic fever viruses. So it's really, really important to have a reliable molecular diagnostic test that can distinguish cases, especially early on in the disease when it's not obvious that it's necessarily Ebola. And this is also really important for confirming deaths because, as I've said before, the 2 main drivers of Ebola epidemics are caring for sick people, so either providing care at home or in a healthcare setting, as well as touching, being in contact with, attending funerals of, or preparing the dead for burial. Both of these things are the primary drivers of Ebola transmission during Ebola epidemics, and Bundabugia virus is a type of Ebola virus. So we've seen the case numbers go down because diagnostic testing has slowly increased and some of the suspected cases have now been ruled out. But we shouldn't really think of this as very comforting because, unfortunately, due to the conflict in the region, the difficulty getting around, and of course, the U.S. withdrawal of foreign aid and withdrawal from the World Health Organization, a lot of the infrastructure that was in place that could facilitate getting samples actually out and getting supplies to the people who are in Ituri province and the areas that have been affected, that's a lot harder to, that's a lot easier said than done. So it's really hard to do. And as a result, the diagnostic testing has continued to lag. Now, the reason I bring this up is because, it's still clear that even though the numbers have gone down and that seems good, now there's a few hundred confirmed cases. I think about a little more than 50 confirmed deaths. That's good. Still too many. There's also the problem of there's a lot of people that have been just completely lost to contact tracing. We don't really know when this began. The earliest report I think we have is sometime towards the end of March, which means that it probably started a couple weeks before that. But we don't really know. It could have also smoldered. We don't have that many genetic sequences for the virus. We don't have that many viral genomes. So we can't accurately look back and see when it emerged into the human population, at least not yet. So in all of this, Marco Rubio, Secretary of State of the U.S., went yesterday before the Senate, the Appropriations Committee, I believe. And he did some explaining because he's really, really trying to justify this no Ebola in the U.S. response. And he's trying to make it look like the U.S. is actually responding in a competent way to this epidemic. So he said that, sorry, Robert F. Kennedy Jr., Health and Human Services Secretary. I know the last time you were hanging out with the Senate Appropriations Committee or the Help Committee, I can't remember which one it was, you told them that, you're thinking about whether or not you're going to give the congressionally appropriated funds to GAVI, the Global Alliance for Vaccine Initiative, I think, is what GAVI stands for. They are the Global Vaccine Alliance, essentially. They provide many, many vaccines to many countries around the world. And they did this previously in tandem with USAID and other foreign aid programs that were funded in large part by the US. They still are heavily dependent on US funding, and this is other countries' national immunization programs that this funds. So this is really, really important because only people in wealthier countries should not be the only people who have access to vaccines. In order for vaccines to work for the whole population, everybody has to get vaccinated, and GAVI is an organization that makes that possible. So Kennedy wasn't releasing the funds that Congress had appropriated for GAVI. And as a result, Marco Rubio has now stepped in and said, too bad, Bobby, I'm overriding you. And we're going to re-engage with GAVI. I don't know what re-engage means, actually, but it's notable that he didn't say we're actually going to fund GAVI. I think re-engage means we're going to talk to them. Fund them is we're going to actually give you the money that we are due to give you because we're obligated to do that. So, I think that this might be just kind of a performative gesture to make it seem as though we are actually going to be doing something more substantive about the Ebola response, when what we should be doing is providing diagnostic tests and helping in terms of providing services for people who are actually treating patients there. We should be providing ways to bring our own people home, especially if they should be exposed to Ebola, because we have world-class facilities that we've invested a fortune in taxpayer money to develop. This is good news if they do it, because I do think that we should keep our obligations to GAVI and fund national immunization programs around the world so that we don't have to deal with preventable diseases anywhere. But it remains to be seen as to whether or not this is going to happen. Okay, so I just want to put a pin in, though, the diagnostic testing component of this. That's really important, and that's relevant to the last topic I'm going to talk about today. But first, I just want to briefly jump in here, and I'm going to be doing this every single day. And that is to note that the Office of Management and Budget has proposed a lot of sweeping changes to federal funding, not just for grants, but for things like roads and schools and hospitals and sewer systems and basic infrastructure. So if you like having those things and you like having government services, I strongly encourage you to write to OMB while the comment period is still open. And it is open until July 13th. I will have a link on the article that accompanies this once I get it out there. And hopefully tomorrow, Liz Janaxi from NIH, previously of NIH, she was a program officer there for 22 years and is probably the world's greatest expert, or at least Substack's greatest expert, on how federal funding works and all of the little nuances that nobody wants to hear about. She has a way of really explaining them very carefully and in a way that is actually engaging enough that you can listen to the finer points of federal grant making and still be engaged and still understand really the tragedy that is happening to all of us at our expense, where this money that we've invested in our future, our own taxpayer money, is being taken away by Russell Vought, the Office of Management and Budget Director, who essentially wants to cancel all government services and redirect those funds to the executive branch of the government. That's all I'm going to say about that for now, but it is also related to the next topic, which is what I'm going to be talking about for the rest of the time today. And that is the fact that the US government has brought charges against two of my colleagues who were employed at the Laboratory of Virology at Rocky Mountain Labs, which is a National Institute of Allergy and Infectious Diseases, or NIAID facility. It's one of the institutes of the National Institutes of Health, or NIH. They were charged after coming into the country in January from a research trip to the Republic of Congo. And during that trip, they were working with a local collaborator there because there's a Clade 1 Mpox outbreak occurring. So they came back and they had some samples with them because they were setting up diagnostic testing capabilities while they were there. And as it turns out, they've actually published with this author. So it's demonstrable that that is what they were doing, but I'm going to talk about that in a moment. What happened was they came in with these samples that had been inactivated. Now, I'm going to talk about this in a little bit more detail in a moment, but when you take samples out of a high containment lab, or when you have samples that you know were infected with a pathogen, especially one that is on the select agent list, which is pathogens that are regulated by federal law in the US, you have to make sure that it's inactivated. Obviously, you don't want to be taking live Ebola out of a maximum containment lab, but you don't want to do that with a lot of the different viruses that we work with. And if you happen to work in the field, if you're doing clinical diagnostics and you suspect that somebody might be infected with something, you want to use these same practices. There's a little bit of a different practice sometimes for diagnostic labs that is different from what happens in a containment laboratory. But for the most part, you know, every situation is you're going to have a risk assessment based on that. And for clinical diagnostics, you're going to treat the samples that you think might be infected with a high consequence pathogen the same way that you would treat samples that you know are infected with or, you know, contain a high consequence pathogen. And so that means inactivating them using a validated method. And the way that we validate these methods is actually experimentally with the pathogens themselves. So we never take anything out of containment until we've done one of these validation protocols. And that is also different at every facility. It's different with every institutional biosafety committee, and it's different in every country. And sometimes it's different in every local area as well, depending on how this is all regulated. But usually what is required is that you will have to set up an experiment where you will have samples that you know have the pathogen in them, and you will essentially have to try to culture the pathogen out of them after treating them with your inactivation protocol. And you have to do this over and over again. Sometimes you have to try to serially passage, although there's no virus in there, serially passage things to make sure that nothing's getting through. You know, it's all completely inactivated. And that is how they do inactivation protocols at Rocky Mountain Labs. And once those samples, those select agents, which Clade 1 Mpox is a select agent, are inactivated, they are no longer treated as select agents unless you can use their genetic material to reconstitute infectious virus directly. So positive sense RNA viruses like SARS coronavirus 1, which is a select agent, it can't be inactivated using this method because you can take its RNA and you can use that to transfect cells like mRNA vaccines do, and you can use that to make new virus. SARS-1 will grow out of that. So you cannot use that inactivation procedure completely to render SARS-1 a non-select agent. But you can do that with Mpox because there is no way to reconstitute Mpox virus from its component DNA, from its genome, essentially. So when a sample undergoes one of these inactivation procedures, it is no longer infectious. It is no longer, for all intents and purposes, a biological sample. Now, basically what happened was Vincent Munster, my colleague, who is a virologist at Rocky Mountain Labs, was coming back with a postdoctoral fellow in his lab, Claude. And they were coming back through customs in Detroit and coming through immigration, and they were pulled out of line and inspected. You know, they had this case with them, which had styrofoam, you know, coolers with tubes in a vial. This was very suspicious to the immigration inspector. And so, you know, they found these tubes and they wanted to know what they were. They said, are these biological samples? Because these have gone through an inactivation procedure, which is in the complaint, and I'll talk about that in a moment. They suggested, and also because these tubes were out of order and they were labeled funny, that these were actually secretly biological samples that weren't properly documented. And so they asked Vincent for paperwork, which he didn't need the type of paperwork that was being requested because, again, these samples had been inactivated. So these samples do need to be declared, and it's not clear that he didn't do that. these samples need to be declared, but they are not considered biological material for the purpose of, he didn't fill out the right paperwork. And in fact, the complaint states that Vincent, who does bring samples back that are considered biological samples, says that when he does bring those, he does what every single one of my colleagues and myself have done in these situations. And he uses a service called World Courier. This service, and there are several others like it, basically provide people to fly samples around the world and make sure that they have all the right paperwork in order to get those samples from one place to another. And so they were not biological samples because he didn't have to use World Courier. He didn't need to get all those extra permits. He didn't need to have somebody personally escorting the samples around because, you can't take them on like a commercial jet line, or you can't take them on whatever Delta flight he was on. So they asked him about this stuff, and he says these samples are for diagnostics. And they essentially didn't believe him. They asked him at one point to write down what is in the samples. And so hilariously, Vincent wrote down essentially the ingredients to a PCR reaction. And DNTPs, by the way, nucleotides, that's also what DNA is made out of. So, this is not a lie, but nonetheless, what they were accused of and what they were actually charged with are two different things. So this is the complaint that they were charged with. They're charged with making false statements. Yet when the the U.S. attorney from the Eastern District of Michigan and the FBI agents and the DOJ officials who were investigating this case did their little press conference about it, they said that Vincent and Quay were trying to smuggle viral pathogens into the country. And yet in the same document, they repeatedly say that they were deactivated. And then I said, well, were they deactivated using a standard protocol? Like, is this true? Like, because what they're charged with is lying. And so fundamentally, the issue here from an evidentiary perspective, and I guess I don't know about the legal perspective because I'm not a lawyer, but from a scientific perspective, how we would investigate this is by testing one of two hypotheses. Either they did it or they didn't. And what did they do? They're being accused of making false statements, saying that these were diagnostic samples and not biological material that they were trying to sneak into the country. Now, they clearly weren't biological material, but this sort of plays fast and loose as to whether or not they were diagnostics. So maybe they were still lying. This is actually not remotely fair, and it's not a good faith effort to investigate something like this. And it's also legal to bring in inactivated samples, provided you declare them. Certainly, it's not something you should face federal charges over, because this actually doesn't present any sort of danger. These samples were all inactivated, so they actually don't contain any infectious clade 1 mpox virus, and they won't. You can't generate new infectious clade 1 mpox virus from these samples. There's no reason to think that they weren't being used for a diagnostic test. Now, I have some other reasons that I think they are from a diagnostic test, but I just want to make it clear what the actual accusation here is. And that accusation is that Vincent made false statements when he told CBP officers or Customs and Border Protection officers that he did not have the biological pathogen, mpox, in his possession, despite knowledge of the identity and origin of the biological materials. And he made materially false statements that the materials were, quote, diagnostics. And Quay said something similar. So the whole issue here is, were these samples used for diagnostics or not? Did they have infectious virus in them? And did Vincent and Quay lie about that? I don't think they did lie about that. And I think these samples were definitely used for diagnostics. And I'm about to tell you why. So I've known Vincent for a long time, and we've collaborated together. And like I said, I know a lot about how to inactivate samples, not only because I work in a high containment laboratory, but also I've been working with Vincent and his colleagues at Rocky Mountain Labs for the past 15 years to study Ebola, to study MERS coronavirus, to study a lot of different pathogens. And I know all about the different ways to inactivate them. So especially for me, because I do transcriptomic work, And really back in the old days when I had microarrays, that's how old I am, to work with, I had to get really good RNA out of these samples. And that was really difficult to do with the procedures that you need to bring samples out of a containment lab. So I have been all over the types of inactivation procedures, both because I have to do them myself and validate them for my own lab, but also I have years of experience doing this with my colleagues at RML, including Vincent Munster. So I know a lot about what they actually do to inactivate these samples and what they actually do to test them. And this complaint had actually information about what they are doing in terms of the procedure that they are using to inactivate these samples. And this is very annoying because, sorry, production issues as always. I failed to upload the right file once again, and now I'm having to do it while I'm talking to you, which is always fun. Okay, here we go. Sorry, guys. I can only do 10 things at once. I can't do 11. All right, here we go. This is the procedure that was used to inactivate these samples. So what they do is they have these samples, and these samples were clearly from, they were originally diagnostic samples. They were patient samples from this outbreak in Congo. And it's very clear, and I'm going to talk about that in a moment, that Vincent was already doing this type of work. But this says here at the bottom in this little paragraph, this says how these samples were inactivated. They were used with a very, very standard technique that has been used over and over again. My facility uses it. My old facility used it. RML uses it. Every facility I've ever heard of that has a BSL-3 or above containment laboratory uses this procedure for isolating RNA. And that is using one of two QIAGEN buffers. It's made by a company called QIAGEN. One is called AVL and one is called RLT. Both buffers contain a lot of salts, and they contain reagents that basically inactivate cells, disrupt them, preserve the RNA, and then you can extract it using a spin column. And one of the steps in this is that you put ethanol, alcohol, into the RLT or AVL buffer. And in this case, it was AVL buffer. And that also completely inactivates everything because ethanol itself is a disinfectant. So, this procedure has been used quite a lot, and that's clearly the samples that he had in his possession. They had undergone this procedure. My favorite part, and I'm not going to get into it because we're running out of time, but my favorite part of this is where the FBI has taken these samples back to their lab, and they are doing all these tests, including trying to culture Mpox virus out of every single one of these samples that, they've stated have been treated this way. So that there's no way that they're going to get Mpox virus out of these samples. And they're still testing all 113 of them anyways to make sure that, Vincent didn't have any Mpox in there. But this is a validated procedure. And I know it's a validated procedure, and it's something that Vincent actually cares quite a bit about because, look, he wrote a paper about it in 2022 where he actually compared a bunch of different buffers, inactivation buffers, with each other and did all of these experiments, these validation experiments to see if they inactivated it. And sure enough, AVL buffer with ethanol still inactivates Mpox virus in Vincent's hands and everybody else's hands that works with it. So these samples were absolutely inactivated. And on top of that, they were probably used for diagnostics because, I don't actually do a lot of field work. I don't really do any field work. I'm not kind of a field work kind of gal. I like to stay in the lab. I like to stay in hotels, not tents. So I'm not like Vincent, where I'm going out and doing this Indiana Jones kind of virology stuff, where he's actually out on the ground, doing this diagnostic PCR and helping out in outbreaks. And one of the things he does is he trains local people how to do the PCR themselves, brings reagents for them to use, and gets them up and running. Now, for some of this, and I misspoke yesterday when I said that because I had looked at this inactivation procedure, but I hadn't had a chance to really deeply read the complaint. I thought that they were generating controls of Mpox RNA or DNA back at RML and then using that as an assay control. And it seems that these were still either assay controls or samples that were being used for assay development for a diagnostic test. For example, these tubes that they're so concerned about. These tubes. Vincent stated that they were in there in weird order and they were labeled this way because the people that they had been working with and training to do the diagnostic testing had just put them into these things that way. That to me suggests that these samples were used for assay development. They were not used or they were used as assay controls. They were not used as biological samples, and they were, in fact, demonstrably not biological samples according to the experiments that the FBI did. So, that part is completely settled. So the only question is, were they using them for diagnostics like they said? And if they were, then, you can't say that they were lying about it because they weren't lying about it. They were doing diagnostics with it. And who cares why they were bringing them back? I think that it's likely that they were doing diagnostics, and I'll show you why. This is the collaborator, a paper that was written by the collaborator in Congo, as well as Vincent, doing, in fact, diagnostics and genomic sequencing of samples from the Republic of Congo. And what I really have to wonder, and Claude is Quay is the first author of this paper. What I really have to wonder is if any of those samples that they had with them were samples that were described in this paper, because if they were, then the federal government's case is game over. Those are clearly not biological samples, and those are clearly known samples that were known to not be infectious, so they were not biological material. They were not an unknown quantity, and they were used for assay development. Now, I can't make that assessment because I haven't seen the sample manifest and I haven't seen any of the metadata associated with it. But, that I think is quite plausible, because here's a paper. Oh, right. And it's published in the Lancet, which is, one of the top medical journals in the world, where they are doing, in fact, diagnostics and genomic epi with samples that are exactly like this and were prepared and inactivated exactly like this. So this is a diagnostic study. This is genomic epi and diagnostics that are exclusively molecular and do not involve any kind of infectious virus at all. Also, there's no virus cloning or any kind of stuff after that. Guess what? Despite what people say and think from probably, reading scary articles about AI and stuff, they think that it's real easy to just order up like an orthopox virus sequence from Twist Biosciences or IDT, and then voila, you've got like an orthopox virus. And it does not work that way. There's a reason why people don't routinely use reverse genetic systems for working with orthopox viruses. It is not trivial. And it's even less trivial than it is for most RNA viruses. I don't even mess with these DNA viruses in that way. And neither does Vincent. So there's no, secret gain of function work going on here. This is literally exactly what he said it was. And this paper demonstrates that. Also, again, these samples, not only has the FBI proved that they were inactivated, but Vincent has a paper from 2022 where he literally was systematically looking at what inactivates samples like this effectively. And I'll say that Vincent kind of knows what he's talking about, because, oh, look, here's this article from the New England Journal of Medicine, where Vincent, the lead author, talks about some of the things that we needed to learn from the West African Ebola outbreak, as well as the second largest Ebola outbreak that has ever happened, which occurred in 2018 in the Democratic Republic of Congo. That also occurred in North Kivu province, which is right next to Ituri province, where the current Bundabugia Ebola virus outbreak is occurring. There are the same issues in this area. There is conflict. There's basically a civil war going on. There's a lot of mistrust of healthcare workers, a lot of suspicion. And it's a really, really complex environment to do outbreak response in. And in that outbreak, just like in the one that's happening right now, a delay in access to diagnostic testing really set it back. Vincent went into this conflict zone, and he was deployed multiple times, both to West Africa and to the DRC outbreak. He's one of the few people who runs into the fire every time to help get this diagnostic testing capacity that's desperately needed in these cases, because again, they are Ebola outbreaks. He's able to go in there and get this set up and work with his Congolese colleagues to do this. And that's actually incredibly helpful. And he's been doing it for the last 10 years at least. And the way that the federal government thanks him for doing this as a public service, as he is a public servant, he is a government scientist, a government employee within the NIAID intramural program, the way that he is thanked for this is arrested and charged with federal crimes for essentially doing work that everybody agrees around the world is critical for controlling and ending Ebola outbreaks and Mpox outbreaks and other emerging virus outbreaks. And this has been discussed as though Vincent is some kind of criminal who's doing suspicious work because he studies emerging viruses that cross species barriers. Well, guess what? So do I. That's why we work together, and that's why we're collaborators. But because we are collaborators, and because I know what Vincent's research program is, and I know what kind of a person he is, I know what kind of a scientist he is like to work with, I know that he is not lying about something also as stupid and trivial as this. So Vincent is Dutch, and he can be blunt, and sometimes he can be kind of arrogant. Maybe that's one reason we like each other. I've been accused of the same thing. I'm not Dutch, though. But, I've been accused of being too confident, and some might say arrogant, and, just sometimes kind of a dick. But that's not a crime. And that is absolutely no reason. I think that it's totally possible that Vincent had no idea that he was being asked something that would get him charged with a federal crime, because we've all been doing this for so long. We know that it's not illegal to bring inactivated samples across borders, provided that you declare them. And maybe not providing the paperwork immediately, that's something that can be fixed. That's a misunderstanding. That is not a reason to completely ruin two people's lives and careers. People who, I should add, have specific expertise that could be helping out with a major public health crisis that's occurring right now, and that is the Bundabugia outbreak in DRC and Uganda. So what our government has done has been to target two of my colleagues basically for being virologists, and both of them being foreign nationals, despite the fact that they've passed security clearances, obviously. And it is not trivial to get a security clearance to work in a lab like this. I had select agent clearance when I lived in the US from 2016 through 2022. And I have the Canadian equivalent of that now. It's an extensive process of background checks. They really do want to make sure that the people who are working in containment laboratories are not going to do anything nefarious, that they are not a security risk themselves. And that's not just that, they're not terrorists, but they're also not careless. They're also going to abide by the law, and they're going to make sure that they fulfill their obligations under the law. And Vincent has been working at Rocky Mountain Labs for the past 20 years. There's nothing to suggest that he doesn't take that with the utmost seriousness, as do I, as do all of my colleagues who work in this field. So just let it sink in. The government finds Vincent Munster and his postdoctoral fellow and colleague to be politically inconvenient because they are doing research that the federal government doesn't want to fund. They are doing virology research on emerging pathogens that emerge in countries that they don't want to give foreign aid to anymore. They already want to destroy the NIH and their NIH employees. On top of that, Vincent works with bats and coronaviruses. And so you can see where this one's going. I have reason to believe, based on what has been filtering out of the lab leak sphere, that, Vincent is being accused of falsely starting the pandemic or being involved in a lab leak that started the pandemic. Now, my own research has shown with many of my colleagues that the pandemic probably was not a lab leak, almost certainly was not a lab leak, and emerged through zoonotic spillover and an emerging virus crossing a species barrier at the Huanan seafood market in Wuhan, China. Vincent was not involved in any of those studies, and Vincent was not involved in creating SARS-2. And none of this is a pretext for arresting somebody for no reason, because there is a political value to arresting them, not because they've actually committed any crime, particularly when the crime that they've committed is being foreign and being a scientist who is working on important global health issues that the US no longer wants to take responsibility for, but is pretending that we're doing a great job at. So I want everybody to take notice of this, because if one person is getting arrested for no reason, other than that Laura Loomer and Paul Thacker and these, journalists who are on the far right extremist spectrum have been demanding, Vincent and several of my colleagues, that they are arrested for months. Now we're actually arresting them. Like, this is the most fundamentally undemocratic thing I could possibly imagine. And it should scare all of us. It really should scare every single one of us, because if there's no due process, if the government can lock us up for any reason on pretextual charges because it's politically convenient for them to do so, America is not America anymore. And we should all be very, very afraid. And with that, I will see you tomorrow. I don't think we're going to have this show tomorrow because I'm going to be traveling. But I hopefully will be able to have an afternoon show with Liz. And if not, then we'll do it next week. But we're going to talk about the OMB stuff. And she's got a lot of insight in terms of some of these mechanisms of defunding science as well, that are, still nefarious, but perhaps not as life-changing and horrible to an individual person as what's happened to my colleagues and friends. So, I just want them to know that I'm going to continue to fight as much as possible for this to be rectified and for their positions and their dignity to be restored, and all of our legal rights to be respected and restored. So with that, I'm going to say goodbye. And I'll see you tomorrow at some point. Have a great one, guys. And sorry to end on such a downer note. The rise of fascism sure sucks, doesn't it? See ya.